All, this is Dr. Mobeen Sayed from drbeen.com. So this is our second session today. This is our random chit chat, and let's talk about things. Good evening. So what did you think about this study? Did you like it? You did not like it? You find the data to be suspicious and suspect, as the Twitter folks were saying? How did you see it? Yes, today is Steve is first today. Steve, you have the trophy. How do I make a trophy with the emojis? I have no idea how to make that. So you have the trophy, Steve. Hi back to everyone. Okay, so let's do some discussion for 20-30 minutes, and then we'll break and continue tomorrow. I was actually going to talk about more ivermectin and drug-drug interactions, but then I saw this study and I saw people just beating up the authors. There are some slightly lesser than rigorous way of doing this study, but the data they found out was interesting. Howdy from cold and powerless Texas. I hope you're okay. So is this that your phone has the power and that is why you're continuing to go on? Chris says, Dr. Bean, my wife is very, very worried to take the vaccine because it's labeled under emergency use. Are there ever going to be approved it without being under emergency use? I think at this time, they're going to keep everything under emergency use for some more time. But they have given it to what now, 101 million people. And within US, 38 or 40 million people. Believe me, if there was something massively wrong with this thing, we would have known it. Yes, I understand that there are deaths that are occurring in very fragile, or they are occurring in some healthy folks as well. For example, idiopathic thrombocytopenic purpura or allergic reactions. But and they need to own them. So far, my criticism of the vaccines is that they're not owning them. They should own them. Then they come back and say, look, here are the things that are more to be observed and seen, and here are the solutions to these things. So they should do that. But look, I can talk about myself that I am waiting. As soon as they call me, I'm going to go get my vaccine. Ganesh, in your country, I believe the vaccines, there are two. One is the AstraZeneca and the other one is Covi. Is that the Covishield, or I always forget that name? Coronavac, I believe, from Bharat Biotech. I think they both are fine. I am not a fan of AstraZeneca. So Novavax is still not given their results yet. Diversity, hello. Janna, I'm a long hauler. My ivermectin is only 3 milligram Monday, Wednesday, Friday. I'm on week 2. I'm worried I'm not taking enough. I'm 135 pounds. So 135 pounds. So this is the dose should be for the ivermectin 150 microgram per kilogram. So first of all, we take 135 pounds and convert that to kilogram. So that is 61. So now 61 kilogram multiplied with, let's say 150, that is 9.15 milligrams. So the dose, again, now please consider this, that is for 3 months or 6 months or a year, and that is 9 milligram. Of course, you are on 3 milligram Monday, Wednesday, and Friday. Monday, Wednesday. I am actually okay with this. So here is what is happening. The half-life is about 18 hours. So Monday, Tuesday, Wednesday, you get again, and then once again. So possibly you are maintaining your blood levels. If I was the one, I would have been, this is what I've been doing with my patients. 9 milligram, for example, if they wanted it, then I would, if they were during the disease, I give it every day. And if they are in prophylaxis, every week. I never had to treat a long hauler with ivermectin, because most of my long haulers patients became okay with steroids. So I would actually ask you that how is this helping? Is it making any difference? Yes, Covaxin. So somehow I have a problem. It just I keep skipping this from Covaxin. So this vaccine and AstraZeneca, Covaxin and AstraZeneca, they, at least from the data that I've seen and the structure, they're both fine. I'm not a fan of AstraZeneca. That is besides the point. Wayne says I have more ivermectin than I need. Sapele Steve says, question, doc, for your information, NIH active 2 clinical trials for COVID treatment, Synergen inhalable beta interferon, 2 long-acting monoclonal antibody, Camostat mesylate. Wow. So Camostat, I love it. AZD, long-acting monoclonal antibody, is that for COVID? Hopefully they should give a polyclonal, but mono is fine as well. And beta interferon is very interesting. I would love this trial. I would love to see it. Ganesh, you're welcome. Jan, yes, somebody was really. So yesterday, I posted a post saying, "Did you have sex on Valentine's?" So that people actually responded to that. But then some people really became very upset with me and said, "You are becoming very inappropriate." I didn't think it was inappropriate. We are all adults here. But anyway, so I had to remove it. I removed it because then people go and report these posts, and that causes a hit on my channel, and then that becomes an issue. Anthony says, "What sex forgot?" Anthony, if you've forgotten, then we're not going to tell you. Jamie says, "Dr. Bean, my D level generally holds about 70. I take 5,000 daily without fail. Latest D level 48. Doctor says it can vary and not worry. Your thoughts on the very comment?" That's correct. So vitamin D, of course, is being used by our body, and it is used by all kind of our cells. Cells have vitamin D receptors in them. So when we need vitamin D to activate various functions of the cell, we'll just pick up the vitamin D and use it. So because of that, our consumption can increase or reduce based on our body stresses and activities. So if you're taking 5,000, I would have preferred 8,000, but that is me. If you're taking 5,000, that is fine as well. Keeping it above 40 is the most important thing. So Steve says, how much K2 and selenium is needed to accompany vitamin D at 10,000? So Steve, what I do is this, and I may be totally wrong. So I have done a video about the dosage of the other vitamins to take with vitamin D. But what I usually do is, I'm probably just a little lazy. I take RDA of other things, but vitamin D, I take 10,000. Jenna says, I've taken steroids, didn't help but clear my pneumonia. I don't know if ivermectin is working yet. I get bad fungal rash, but other than just writing it out. Thanks for confirming my dose. Okay. Yep. So Terry says that, why are you not a fan of AstraZeneca? Because their trial data is still not clear. 62% efficacy in one country, 92% in other country. They collated the two groups and said 72%. And these folks who were objecting about the study, they never objected about AstraZeneca's collating. Their collation of the groups was actually wrong because they had different doses, remember? And then the second problem is that they said full dose is less efficacious than half dose, full dose, which is more. And that was an accident that they had half dose and full dose. And they still cannot explain it, which is fine. There are so many medical concepts that we cannot explain. So these are the two things that I'm still not very comfortable with. And I'm waiting. So they're doing a trial here in the US, I think on 30,000 folks. I'm waiting on the results for that. Margaret, hello, how are you? Wow. Wayne says, I was detained at the border yesterday and boy, I was scared. The border agent anything to declare. And I told him I was acting for CV and my friend had texted me to buy some Viagra. That was Valentine's. Hmm. So did they, of course, if you're talking with us, they let you go, huh? That is correct. So, Golmukh, you're correct on this that AstraZeneca have more than a few problems with the data. However, it is still going to work against severe COVID 19 for moderate and mild. It's not good. That is correct. I agree with you on that one. They actually did the challenge test on chimpanzees as well, and they could not create severe COVID from them. William Goff says, do you feel that at home fingerstick vitamin D level tests are as accurate as venipuncture tests done in the lab? No, I don't think so. Because remember, I had this Kivano strips and they showed my levels to be quite low. Again, to be fair to them, ideally, if I really want to test them, then what I should have been doing is I should have been in the lab, do the test with Kivano, and simultaneously give them the blood as well so they can actually be matched. I did not do that, so maybe they were correct. Having said that, those tests, for example, in the US, where you give them the blood and then they send it over to the lab, they should be fine. I would prefer more full at home tests like Kivano. So not yet. This is what I've been planning to, and you can see now that every day there is a topic that supersedes. I still have to talk about quercetin and ivermectin. Jason says, I'm a new subscriber to your channel. Is it safe to buy pharmaceuticals like ivermectin from India? I ordered some from India recently. Just want to be sure it's okay to take. Thanks. No idea. So, number one, I'm not from India. Number two, I'm not sure. Um, um, how are they doing the quality controls? So I can't say yes or I can't say no because I just don't know. Wow, that is great news. Sapele Steve says, my wife and me are getting our first dose of the Moderna vaccine on Saturday, Feb 27th. Can't wait. Excellent. Congratulations. Holik says, a well-known public figure in my place uses vitamin D's as argument and tell people not to vaccine and take vitamin D instead. Any thoughts on this? So that is his problem. He shouldn't do this. Vaccines have their own benefit. Vitamin D has its own benefit. So this is why people were attacking so passionately on the study. So they're trying to knock down anything that would not that would prevent a person from taking a vaccine. But I think we should have the whole menu open. We should have everything available and then let people make their choices. I am not anti vax. I'm not anti mask. Even then, this is not the time to start just saying, you know what, you are anti vaxxer and so uh, you are a bad person and now either take this vaccine or we're not going to even talk with you. That's not fair. At this time, we should either alleviate the problems that make someone anti vaxxer or at least provide alternative options as well. I would take vitamin D, ivermectin, and vaccine. Hey, Doug, how are you? Absolutely. Goldmuk says everything is a tool to help. Yes. Is Eric here? I'm bringing it back. Doesn't seem to be a problem at all as long as you declare it. So, Wayne, did you bring it from someplace to US? So, serotonin efficacious against COVID. So, we are seeing, Burj, that um, fluvoxamine, which kind of increases the serotonin level by reducing its reuptake, is helping the neurological signs and symptoms. Now, what I do not know yet is that is it just helping the signs and symptoms, or it is actually fixing something underneath as well. Gold Country Russ says, I want to know if I was actually infected 28 days ago, which is the best test, C19 antibody or cDNA RNA? Both are available to me. I would get both. If you're still infected, you would have RNA positive. And if you have the antibodies developed, your body has developed the response, you would have antibodies as well. Now, there is a third chance where you have recovered, but through the cytotoxic T cell pathway, where you would not have RT-PCR positive, plus you would not have antibodies as well. So don't get too worried if you have already taken care of your body. Mexico, becoming an expert in buying Mexico runs. That is correct. That people who are just same for ivermectin as well, and same for just kicking each other for no good reason. I'm just looking here for Robert Roland says, good evening. Please discuss drug-drug interaction between and fluvoxamine. I'm a doctor from Argentina. I'm using both drugs. Sometimes I think I had taken this note, and ivermectin and quercetin, ivermectin and fluvoxamine, drug-drug interactions. Joe B says, one day after getting my first Pfizer vaccine, my HR variability plummeted from heart rate from average 75 to 20. What? Any physiological reason? From average to 20. Tell me more when you said HR. Did I get it wrong? Jim says, my urine arsenic levels tested way high, about 60 versus 13. I figured it was from all the seaweed I was. Possible. Yes. Possible. Yes. Seaweed has a lot of arsenic. I first thought you've written weed. And so I chuckled. But then, yes, seaweed. Yeah, seaweed have arsenic. Sapele Steve says the wife had COVID and got better, so should she only get the one vaccine dose and not the second shot? Just curious. So for her, even the one vaccine dose is like the second shot, because she had the infection and she overcame it. So in theory, she doesn't need any vaccine dose. But if you're going to get it, then get both the doses. It's not going to be any different. I think she's going to her body is not even care for the vaccine. Wayne says, is ivermectin a narcotic? Technically not, because it's not a molecule for narcosis. But at the same time, if it does enter the blood-brain barrier and crosses that barrier and goes to brain, it does adhere and cause changes in the brain activity, because it is a modulator of the chloride channels. So it can sort of affect on the brain. Carlos says, you have explained that we have never used ivermectin this way before, frequent prophylaxis. With that said, would you foresee any problem with the long-term usage? No. So the only one ever reported case of liver, one ever in the history of ivermectin, is one time a woman had a liver or hepatitis with ivermectin. And I had talked about that before. Or then this study on mice, which showed that it is possible that it can cause testicular damage. Or then a study from Nigeria where they said it is possible that it can cause testicular damage. But for testicular damage, vitamin E and selenium are sufficient. For hepatitis, that has never been seen again. And so far, everyone who has been administering ivermectin, including me, has not seen any stress on these organs. Malnificent Mars says, thanks, Dr. Bean, for your very informative lectures. How many milligram can I supplement on Kalwanji? Can you do a lecture on nitric oxide? So I have already done a lecture on nitric oxide in cardiovascular system. I don't know if it is on YouTube or on our site. And the Kalwanji, I have done Kalwanji discussion before as well. I take 1 teaspoon of Kalwanji oil daily, or black seed oil. Zunar says that currently any vaccine that have data that shows to stop the spread of the virus. So there is, I think there is just one vaccine, Pfizer's vaccine, that have shown to reduce the spread by 76%. But look, think about it. How would you know that vaccine reduces spread? You vaccinate a person, and now you let the person move around in the society, and how are you going to measure if he got infected and then infected someone else or not? So because of that, it is kind of difficult to measure this. They still have been following people, and they think that it reduces the spread, but it does not abolish the spread. Sino says, vaccine side effects can it be reduced by high vitamin D levels? So number one, please remember, greater than 100 nanomole per liter is dangerous. So don't bring your vitamin D levels to too high. Secondly, vitamin D's job is to modulate the immune system. It would not kind of suppress any of the effects. Carol says, can you be on an antibiotic for ear infection and still take the vaccine? So of course, the best is to ask your doctor, or when you go for the vaccination, talk with them as well. But from my general information, hypothetically, it should not matter. Vaccine is just working with the immune system. Antibiotic is either stopping a bacteria from replicating or killing it. So they were both two very separate things. Embol says 100 nanogram per milliliter, not nanomole. Okay. Yes. Yes. Cool. Riku USA says that it is an antiparasitic. Yes, it is. Diversity Love says, I did tribal belly dance tonight. Very good. Jan, how are you? So Luffy had been active here before. So nowadays, I think his sleeping times keep changing with the season. And so he was here very active before, and now he is gone. Where is France from Chief Luffy? I thought of France as well. Is Japan here? Liana Morris says, hi, Dr. Bean from Atlanta. Hello, back to you as well. So Craig says, any thoughts on exo CD24? I have to get some more data. I think there is some mechanism that is being explained nowadays. So I'm going to look into that and talk about it. Yes, yes, 100 nanogram per milliliter. Wiley says, would convalescent plasma be more effective if it were coming from only people with high vitamin D levels? And would this be why plasma only works some of the time? So the vitamin D's function is to help modulate the immune system to better respond. And that response that is better is through the T helper cells that include then finally producing the antibodies and also the T helper 1 cells as well, which is cytotoxic. So, of course, somebody who is on vitamin D's, they would have a more balanced response and probably the right titers in their plasma. However, the plasma, when it is collected there, they also collect it by seeing that the person has the right titers in them. It's the problem is mostly the binding affinity of the immunoglobulin in me, and then if it is given to you, will it behave the same way in your body as well? That's the basic problem. So, can someone with thrombocytopenia take vaccine? Ideally, yes, from their literature. However, as we have seen that there have been cases where thrombocytopenic purpura has occurred, I would suggest you talk with them before you talk with your doctor as well, and then decide. James says, does the immune system change as we age? Does this change effectiveness of vaccine? So immune system reduces its function as we age because number one, the cells function less. Number two, their number of cells reduce as well. However, they have seen that the effectivity of vaccine was only a few percent low. For example, I believe in case of Pfizer, it was generally 94% and in older age 94 or 90%. So not a huge difference. Point Farmer Wurzel Gamij says, I hope I pronounced your name correctly. First time watching live from Scotland. Thanks for all the great info, Dr. Mubin. You are very welcome. And welcome to the show. So Jenna has a question. Ivermectin help any of you long haulers with CFS? That would be an interesting one that I need to know as well. Jenna says, I'm sleepy, going to sleep. All right. Thank you, Jenna. We're going to stop as well in another 5 minutes. Gold Country Russ says, question, something in the IMAS protocol has eliminated my joint pain and inflammation. Cancel epidurals for lower back and naproxen 5. Can I continue long term? Um, Ideally, yes. So one thing that you can do is you can probably remove one thing at a time to see which one was the one that was helping, and then maybe just continue with that and see the side effects for that thing. But I'm sure that this is something to do with the vitamin D's and C's and ivermectin. Sayed Saifullah says, I have a question that is not today topic, but some problems are heart is storage and decision making organ or brain. Quran say heart is decision making organ. I have no idea. I can't comment. Look, no idea. I can't talk on the spiritual levels for these things. I can talk more medically and conceptually from medical concepts. Doug says we have a new bean. Absolutely. Carol, I just saw your question here. That can I take ivermectin with hydroxychloroquine? So again, these are good questions for your doctor. Please don't take my answers for you because that I cannot do online. Hypothetically, or for my patients, when I was transitioning from hydroxy to ivermectin, I was giving them both in the beginning. Yes, Jamie. Hassan Bloy says, didn't do any social distancing, even exposed with COVID patients, but nothing happened to me. So should I also vaccinate? So the question is, Hassan, that did you actually develop antibodies? Were you exposed to a low dose and then you developed antibodies? If that was the case, then you don't need vaccines. But if you were just very, very good at protecting yourself, then you need vaccines. So I don't know exactly what is your body situation. I would say just take vaccine. It's not a bad thing. Thank you very much, James. Yes, it has minimal impact. Robert says you're doing a great job. Thank you very much. Carol says how to wean off hydroxy. So you can just stop it whenever you want. It is not something that needs to be weaned off. But again, please talk with your doctor. Don't put me in trouble, and don't uh, get yourself in trouble. Talk with your doctor, and then. Jim says the older we get, the more vitamin D3 we need. A 70-year-old needs 4 times the D3 as their prior 70-year-old body did. I have not heard that they need this much levels, but generally vitamin D's needs are increased because our body's metabolisms and vitamin D manufacturing and mobility and usage reduces. That is why we start developing so many bone and other issues. So vitamin D should be increased, but I did not know that it is 4 times. That may be just my ignorance. Eddie says thoughts on Novavax. So Eddie, I did a talk about Novavax. I actually like it. I am waiting for their trial result to see their efficacy. Nais Trust says, does your hand play a direct role for the lungs? No idea what this question is. And from hand, I remembered somebody had placed a comment on YouTube saying, just look at this person's hands. His hands are making satanic gestures. And I was trying to figure out what are the satanic gestures. I did not even know. You're welcome, Ganesh. Good night. So Peggy, I have already talked about statins in detail and vitamin D about 6 or 7 times. So please just look through my channel. There is a playlist called all COVID-19 videos. In there, if you just search for statins or vitamin D, you would see all the videos. Cool. So let's break for today. We'll continue tomorrow. Please do me a favor, like, subscribe, and share. There is a link in the description for becoming my patron, another link to buy me a coffee, or if you just wanted to support my work, there's a link to. And if you can, the minimum, just like the video, and that would be great as well. Thank you very much. Stay safe and healthy, and I would see you tomorrow.